Hey everyone, we've got another specimen today. This is number 817 in our collection. The heart would have sat roughly in the chest like this. Anterior surface coming out towards the screen, posterior surface towards the turntable, inferior legs here, superior head here, left over here, and then right over here. Let's start off as we usually do, which is by trying to identify at least externally what appears to be the right atrial appendage. And here we have an appendage that appears to be triangular, broad-based, or pyramidal in shape. So why don't we go ahead and open up the heart there. And when we do that, we do find that there are, in fact, pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. And then as we look into this right atrium more, we do find the oval fossa here, which appears to be intact. Here is the mouth of the coronary sinus, and here is the tendon of Todaro. And we know every time we talk about the mouth of the coronary sinus and the tendon of Todaro, it's necessary to mention that these are 2 out of 3 structures that form the triangle of Koch. The third being the right-sided atrioventricular valve. And if we form the triangle of Koch here, at its apex is where we expect the atrioventricular node to live. So here's the mouth of the coronary sinus, here's the tendon of Todaro, here's the right-sided atrioventricular valve, and at the apex of this triangle is where we would expect the atrioventricular node to be. Now, we come across the right-sided atrioventricular junction. We do find that there is an atrioventricular valve here. This valve does appear to have 3 leaflets, 1, 2, and 3. And this valve also has direct connections to the ventricular septum, consistent with the morphologic tricuspid valve. So here's the anterior leaflet, here's the septal leaflet, here's the inferior leaflet of the tricuspid valve. When we look at this ventricle here, it has coarse trabeculations. There's a moderator band, aka a septomarginal trabeculation, all consistent with a morphologic right ventricle. And we see that the ventricular septum is intact. Here is the right ventricular outflow tract. We do find it is guarded by a 3-leaflet arterial or semilunar valve, 1, 2, and then here's the 3rd leaflet that's transected. And there's 3 sinuses, 1, 2, and 3. There are no coronary arteries arising from within these sinuses, all consistent with a morphologic pulmonary valve. And as always, I think it's important to mention that with the arterial valves, that there is no true round or oval-shaped annulus. While the atrioventricular valves do have an oval annulus, the annulus here of the arterial valves, both the pulmonary and aortic valves, is actually this kind of crown shape, because these fibrous leaflets actually have muscular or myocardial triangles that interpose between them. These interleaflet triangles that are actually myocardium. So the true annulus is actually this crown shape. Although the man-made annulus that we do use clinically, that doesn't mean it's not helpful. Here's the pulmonary trunk, which does give rise to the branch pulmonary arteries. And then let's flip the heart over to look at the back. Here's the posterior surface of the heart. Here's the left atrial appendage. And then why don't we go ahead and open up this left atrium? And this is where we find an interesting feature. Here in the left atrium, we do see that, in fact, the left atrium is divided into 2 components. Here's a pulmonary venous component, and then here's the vestibular component. Some might call this the proximal and the distal component. Once again, here is the part of the left atrium where the pulmonary veins drain into. This right here is actually an abnormal membrane that has formed here. And you can see that it ends before the mitral valve begins. Now when we flip this dividing membrane over, and you can see it now kind of in its short axis here, but when we flip this over, here we find that there in fact is an atrial septal defect of the oval fossa, which we didn't see from the right. And then here is the mouth of the left atrial appendage. This is what we usually see which is that the mouth of the left atrial appendage and that the oval fossa reside in this vestibular component, while then the pulmonary veins end up draining and reside in this pulmonary venous component, or if you'd rather call them the proximal and distal components, although it's somewhat inaccurate to call them proximal and distal. And right off the bat, you'll see a lot of the medical illustrations that we use often demonstrate a membrane going in the other direction and dividing the atrium in a separate direction. That's usually not the case. Usually this membrane does come down this way and will have one or two openings at its distal end. So there might be a turn of this membrane here if there's a restrictive orifice draining this pulmonary venous component. So once again, here is the pulmonary venous component. We'll flip over the membrane here, and then here is the vestibular component. When we look at the left-sided atrioventricular valve, there is a valve with two leaflets, 1, 2, and this valve does not have any connections to the ventricular septum, consistent with the morphologic mitral valve. When we look at this ventricle, there's fine crisscross trabeculations consistent with the morphologic left ventricle. And then when we get into the outflow tract of this left ventricle, we do find another arterial valve. Once again, this arterial valve does not have a round or oval-shaped annulus. It does have this crown-shaped annulus, as there are fibrous valvar leaflets with myocardial triangles interposed. However, unlike the pulmonary valve, the aortic valve is only supported by bustle, partially, as there is fibrous continuity between the anterior leaflet of the mitral valve and part of the aortic valve. We do see a coronary artery arising from within the sinus here of the aortic valve, and then here is the ascending aorta. So the key feature of this heart is in fact that there is a divided left atrium, and you are now looking up at it. Towards the right of the screen is the pulmonary venous component. Now we'll move this dividing component a little bit, and you will now see the vestibular component, which has the oval fossa atrial septal defect as well as the mouth of the left atrial appendage. And here we are looking down at this dividing membrane of the left atrium.